want to talk about rectus diastasis. So that's a term some of you may have heard of. It's something that we typically take care of during a tummy tuck or a body lift. So what rectus diastasis is, it's separation of the abdominal wall muscles. This often happens in women who've had multiple children and people who've been overweight. Just like the skin stretches out to make room for the baby, the muscles stretch out. It's actually not even the muscles, it's the tissue between the muscles called the fascia that stretches out. And just like the skin doesn't always snap back after pregnancy, especially after a couple pregnancies, that fascia doesn't snap back. And so you get this separation of muscles, and what that ends up leading to is kind of a poking out of the stomach because the muscles aren't aligned like they're supposed to, and everything on the inside just pushes out. And a lot of women will say, oh, I still look pregnant even though I had my baby, and that's usually due to this diastasis. So in a tummy tuck or a body lift, what I end up doing is repairing that diastasis with stitches. We actually bring those muscles back together, and it almost acts like an internal corset, kind of shapes the waist and flattens the tummy out. So it's a powerful part of a tummy tuck or body lift. So I want to show you a few examples of some of my patients. This is a woman who had two children, had multiple children, and had quite a significant diastasis. Again, she said she felt like she always looked pregnant. And after the tummy tuck, you can see how flat her tummy is and how contoured her tummy is. Here's another example of a woman who had multiple kids, overall great shape, but she just had this bulge to her tummy. And then after the tummy tuck, has a really nice flat tummy. We got another patient here, a good example as well. You can tell overall she's pretty small, but she had this bulge going on that made her look a lot bigger than she was. And once we did the tummy tuck, she has a really flat, tight tummy. And here's a woman who had twins. This is common in women who've had multiple kids at one time. She had, again, quite a significant diastasis. She has the loose skin that we see a lot as well, and the tummy tuck really took care of that. So this is a powerful part of the tummy tuck or body lift. So if you're interested in learning more about it, to come in for a consult.